Welcome, everyone. My name is Lynn Wilson, and I'm the President and Director of Research for Myositis Support and Understanding. But most importantly, I'm a dermatomyositis patient. Established in 2015, MSU is a nonprofit, all-patient volunteer community dedicated to improving the lives of myositis patients and families everywhere. And now, over to you, James.
We get to turn to the core of today's meeting, which is to hear from you. People living with dermatomyositis and their parents, spouses, and other direct caregivers.
My name is Austin. I am 38 years old, and I live in Champaign, Illinois. In May of 2023, I started developing a rash on my hands and eyes. By early June, I had developed joint pain and noticed a slight shortness of breath. I saw a pulmonologist at the end of June, and I could barely get through the pulmonary function test, as taking deep breaths hurt immensely. The pulmonologist looked at my hands and correctly identified that I had dermatomyositis. He suggested that I see a rheumatologist. 3 days later, I went to the rheumatologist. The nurse saw that my blood oxygen saturation was at 80%, so they called an ambulance for me, and I went to the ER. I stayed in the hospital for about a week. A CT scan showed that I had rapidly progressing interstitial lung disease, and I left the hospital on 4 liters of supplemental oxygen. I was functionally disabled and bedridden. My wife, mother, and stepmother took care of me. Any physical exertion dropped my oxygen saturation. I couldn't even get up to go to the bathroom without my oxygen saturation dropping to 80%. Taking deep breaths hurt immensely. I was afraid of yawning because of the pain. If I did leave the house, I needed to bring 2 oxygen tanks with me. The few times that I had to use stairs, it took me about half an hour to recover. My myositis antibody panel came back with my MDA5 titer at over 100, confirming the diagnosis. My local rheumatologist encouraged me to go to Barnes Jewish Hospital in St. Louis and see a rheumatologist there. After checking into Barnes, they started me on tacrolimus and gave me IVIG and rituximab infusions. These were reasonable treatments for dermatomyositis, but they were slow. It could take months for the medication to work. And I was very worried that even if the medication worked, there would be too much scarring on my lungs already. I mean, how much could my lungs really recover? I could be on 8 liters of supplemental oxygen for the rest of my life. At the beginning of August, after a telehealth appointment, it was clear that my interstitial lung disease was not slowing down. I was encouraged to go see a pulmonologist at Barnes and to get a pulmonary function test and to get onto the lung transplant wait list. I was terrified, as this was the first time that a doctor had suggested a lung transplant. My PFT was terrible, about 30% lung function. The pulmonologist arranged for me to check back into Barnes the next day. In the hospital, my oxygen needs exceeded 10 liters, and I began the process of evaluation to get onto the lung transplant wait list. I had to prove that I was physically able to recover from the surgery. One part of the test was walking for 30 minutes on a treadmill. I had an hour to do it, and I would be on oxygen. This was very challenging, as I had deconditioned my body over the past 2 months, and a coughing fit would set me back at least 5 to 10 minutes. Despite this hurdle, I managed to complete the test. The next day, I had a fever and I was transferred to the ICU. A week after checking into Barnes at 4 p.m., I was informed that I was on the transplant wait list. At 8 p.m. that day, I started having respiratory failure caused by my dermatomyositis. My respiratory rate dramatically increased as my body tried to get enough oxygen. It was not painful, as the supplemental oxygen kept me comfortable, but intellectually, I knew that I was dying. The doctors asked permission to sedate me, intubate me, and put me on life support. I figured I either wake up with new lungs or I die, and both possibilities seemed fine. I was heartbroken at the thought of leaving my family behind, but I was so tired of my physical decay. 3 days later, I woke up with a tube down my throat and was still being weaned off of life support, but I could tell that I could breathe, and I knew that I'd had the transplant. I spent about 12 days in the ICU. A lack of sleep and ICU delirium really made those 2 weeks a waking nightmare, but I was physically improving. I was moved to a rehab unit and spent another 17 days there building up my strength again, and I spent 3 months doing outpatient rehab before returning to my home in Champaign. I am now on immunosuppressants for life, and each month I get blood tests, a chest x-ray, and a pulmonary function test to watch for signs of rejection. My skin rash has improved due to regular IVIG infusions, and for now, it seems like my dermatomyositis is under control. I was very traumatized from this experience, and I was terrified of my new lungs being attacked by my immune system again. Over the past few months, that fear has lessened, although I still have a fear of some form of chronic rejection, kidney issues due to the medication that I'm on, or catching some external respiratory illness. It is quite likely that one or more of these things will happen to me in my lifetime. I am very angry at the underlying disease for nearly killing me. Dermatomyositis spontaneously destroyed my health. It brought me from living a healthy life to my deathbed in the span of about 3 months. I'm only alive because of the lung transplant, and if I'm lucky, I will live another 25 to 30 years. However, the median survival for lung transplant recipients is 4 to 6 years. Dermatomyositis easily took at least 30 or more years off of my life, and I hope to spend the rest of my life disease-free, embracing life with my family, without having to worry about interstitial lung disease ever again.
I'm Hannah. I'm 34 years old and live in Pittsburgh, Pennsylvania. Dermatomyositis has affected my life for the past 15 years, physically, mentally, and socially. At 19, during my freshman year of college, attending Bowling Green University and majoring in aviation, I experienced a bright red rash on my face and chest, along with severe exhaustion. Daily routines like showering and dressing totally wiped me out. It was almost impossible for me to walk across campus to my classes or bike to the airport 3 days a week for my pilot training. The campus doctors referred me to a local doctor who ran several tests but could not diagnose my problem. Since aviation understandably requires a perfect bill of health, I decided to drop out of school at the end of the semester and come up with a new plan for my career and my health. I moved back home, enrolled in the local community college to keep my health insurance, and tried to regain my strength. This was a frustrating time for me. Along with severe exhaustion and the rash, I began to experience muscle pain and weakness. Since my only visible symptom was the rash, my family and friends did not always believe me when I said I was tired or weak. They thought I was depressed, out of shape, or it was all in my head. After 2 emergency room visits, no one could find the cause, and no one suggested that this could have been an autoimmune disease. During this time, I became so weak that I fell just walking up the stairs at school. Eventually, I was hospitalized and diagnosed with dermatomyositis. Later that year, I moved to Florida to attend the Walt Disney World College program, but I needed special accommodations that were medically approved so I could work indoors seated. In my own day-to-day life, things changed. I could not stay in the sun at the pool with my friends. I needed a wheelchair to be able to spend all day in the theme parks. I had to take things at a much slower pace than everyone else my age, and I needed days just to rest if I overdid it. I flew back to Pennsylvania every 4 months to see my doctor and have my blood work monitored. I love Florida. My aches and pains lessened in the climate, and the sunshine did wonders for my mood. I bought a home, which was a fixer-upper, and this presented a new set of challenges. I could not paint or do any of the remodeling I had envisioned. My family had to fly down from Pennsylvania to help me. I also adopted 2 rescue dogs to keep me company. There were times when I was not able to walk them due to my muscle weakness. Fortunately, I had a large fenced-in yard that allowed them to run. Fast forward to when I was 27, married, and wanting to have a child. I was in the process of finding a new local rheumatologist, and she told me I should never even try to have a child. This was very disheartening, as my last rheumatologist had told me I'd be able to get pregnant and just to have a high-risk pregnancy doctor lined up in case there was complications. I ended up not going back to her, and I found a new doctor who said he would help me along the way. I had to be off my medication for the time leading up to becoming pregnant, which left me weaker and my rash worse. I was blessed to have a healthy pregnancy and delivery. My son was born with jaundice and needed blood drawn every few days, but I was unable to take him, so I had to rely on my mom and husband to take him to all his appointments. I was also not able to breastfeed my son due to the medications I needed to start back up after delivery. My recovery was worse than a normal woman would have. I struggled to pick up my son some days and relied heavily on my husband and my mom, who stayed with us for 2 weeks to help. Though improved, my rash has always been present and itches constantly. My muscle weakness and pain come and go depending on my activity levels. I must add in rest days on vacations between days of a lot of walking. Days where I'm more tired can become frustrating for my son, who just wants to go out on an adventure with his mom. My symptoms always make me embarrassed by things like going to get my nails done, as the technicians have always made comments or asked questions about my cuticles and my rash on my hands. I always try to wear high neck shirts and bathing suits and keep my hair down because of my rash on my chest and my back. I never leave the house without makeup to cover up the red around my eyes and my hairline. It'd be nice to not to have to worry or feel self-conscious about these little things. I've learned to live with my dermatomyositis and try not to let it affect my life in substantial ways. I will always have to adjust my lifestyle around it, and my family will always have to be flexible in dealing with me as well. Sadly, most people do not see the day-to-day challenges or frustrations that come along with living with a disease like this. My worries for my future are that my mobility is decreased and I can no longer do normal activities. I worry I won't be able to keep up with my son, and I may become a burden for him or my family. Complications of dermatomyositis, such as increased risk of infections, cancers, or the effects on my body from the long-term use of my medication, worry me as well. I hope my medications continue to work for me and the availability of them doesn't change. I want to be as healthy as I possibly can be to live to see my son and nieces and nephews grow up and accomplish everything that they want. Thank you.
Hi, I'm Stephen Moore. I'm 36 years old, and for over a decade, I've been on a long and challenging journey with dermatomyositis. Looking back, it all started around 2006 at the age of 20 during my studies in neuroscience at the University of Alabama. The first sign that something was off was waking up with inexplicable soreness all over my body. Initially, I tried to brush it off. I attributed it to long work and study hours. However, the situation worsened, leading to ulcerations caused by excessive use of Advil for pain relief. I ended up vomiting blood and had to be taken and admitted to the hospital. A few months later, I woke up with a red, swollen right hand, so I went to the Student Health Center for answers. The physician dismissed me, saying I must have punched something and broke my hand, but the x-ray showed that I was telling the truth and nothing was broken, so they referred me to a rheumatologist. My path to diagnosis was highly frustrating. In 2011, during my graduate studies, it was like deja vu. I became sicker to the point where I had to revisit the Student Health Center. My list of symptoms had gotten much longer, and I was experiencing extreme fatigue, muscle joint pain, severe rashes, hair loss, muscle weakness, bleeding, stomach ulcers, and kidney stones. I told my doctor that the pain and fatigue was getting so constant and throbbing, where my body felt like I had just played in an intense football game every morning when I woke up. My skin rashes and lesions were so severe that my skin would crack, and I would often get staph infections with pus oozing out. In retrospect, I wasn't sure what feeling normal was anymore. Initially, the physicians suspected me of having lupus, and thus I was subjected to various treatments, including Cellcept and prednisone. However, the journey to diagnosis was a series of ups and downs, with my condition being misinterpreted multiple times. I was experiencing more abnormal rashes and losing significant weight. I lost about 40 pounds in 3 months. And my rheumatologist at UAB delved deeper and found I had an elevated CK, including abnormal EMG and other blood studies. I was finally diagnosed with dermatomyositis in September 2012, 6 years after my first attempts to finding answers. I was apprehensive about this diagnosis when I checked on PubMed, and I found that the mortality rate could be up to 50% at the 10-year mark. I know I can say that this insidious disease has now affected just about every system of my body and is relentless. I have to take breaks more frequently during work, and the pain and fatigue can be so unbearable at times. There are days where I literally can't get out of bed due to this fatigue and pain. My journey has been marked by several relapses and persistent symptoms. After being on prednisone and Imuran for 6 months, I developed a high fever along with gouty papules, which required admission to the hospital for more tests and a skin biopsy. Then I changed to methotrexate and had yet another flare. After that, I was prescribed rituximab infusions, and shortly after the second infusion cycle, I had another flare with a fever and had to go to the ER again. I had a blood report of no white cells, and I was placed in the ICU, and this was one of my first close calls to death. One of the most challenging aspects of living with dermatomyositis has been dealing with the skin symptoms, particularly the intense, painful itching that keeps you up all night with a burning sensation where you wish you just didn't even have skin. I resorted to various measures to alleviate this discomfort, including bleach baths in my tub, a remedy that might sound extreme to most of you, but that I found necessary to get some relief from the persistent itching. I'm also a cancer survivor of kidney carcinoma, which cancer is more prevalent in dermatomyositis. Managing this disease has been a constant battle, not just physically, but emotionally and mentally as well. The impacts of this condition on my personal life have been profound, from navigating graduate school with this disease to dealing with the significant side effects of the medications. It's been a challenge that required immense strength and resilience. I recently got married, and I had to plan my wedding and my honeymoon between IVIG infusions, as you can see, as I am getting now. I always worry about how that impacts my marriage. As much as I hate to admit it, there are times when I can't take my wife out or do things we used to enjoy, such as hiking. We're both huge football fans and love tailgating, but it's a challenge for me to walk across campus, so we have to limit our activities. Even simple tasks like cooking and cleaning can be a problem, especially on tough days. These are just some examples of what the limitations in my life are, where I feel like a prisoner to dermatomyositis.
I'm Kaniah. I am 40 years old, mother of two children, 21-year-old with cerebral palsy and a 15-year-old son. My personal journey with NXP2 dermatomyositis has been a roller coaster ride. It all began in 2007 with symptoms that baffled local doctors. I was tripping and falling, unable to climb stairs, developed skin rashes, swelling in my face and hands, difficulty swallowing, heavy breathing, and muscle weakness. I was diagnosed with dermatomyositis. Working became a challenge, and my health issues were invisible to the outside world. I was in denial. The disease affected me mentally, physically, emotionally, and spiritually. In 2007, my CK was 8,000, and my organs were shutting down. I was on prednisone and Tylenol at the time. Dreaming of expanding my family, I braved a high-risk pregnancy in 2008 and was blessed with a healthy boy. Post-pregnancy, I enjoyed a brief remission, but soon after, relentless fatigue returned, and I was hit with the full force of the disease, just as I resumed work from FMLA leave. In 2010, I relapsed again, and I had 2 ulcers in my stomach. I was sweating bullets that day, and I was admitted to the hospital for a week. I had alopecia and my hair was falling out. I still had difficulty swallowing and severe pain. I had to have a stomach procedure. I then was referred to the Myositis Center at Johns Hopkins. At the time, I was so weak I could not raise my arm to comb my hair or dress myself. The calcification started to make progress all over my body, my chest, arms, hips, and thighs. I had to use a walker and needed assistance to bathe. I recall having swelling on my face, and the orbits of my eyelids were swollen 3 centimeters away from my face. Another dermatomyositis sign. This was the moment I lost my confidence and became unrecognizable. After my discussion with my doctor about treatment and quality of life, I now had a long-term glimpse of what it would take to get a hold of this disease. As a patient, I was looking for a quick fix to see that the disease would go away. We started with IVIG, which involved numerous specialists and contact with Hopkins with pre-med orders. IVIG has been transformative, despite the calcifications and physical limitations and the disease has caused. I started to improve. Thanks to vigorous testing and therapy, the road to recovery was long and winding. I had to relearn basic tasks, relying on physical therapy and family support. My condition demanded constant attention and adaptation. In 2012, I had to take care of my special needs child. It was a lot being a single mother. I went into financial hardship and I had to apply for disability and Medicaid. Sometimes I could not afford to drive myself to see the doctor. I was in denial about my condition and my invisible disease, hiding under my clothes. I often got infections due to my immunosuppression, even requiring surgery, due to glaciers of calcium deposits leaking out. Often they were the size of a grapefruit. I still live with wounds and scars. Until today, if I get out in the sun, my skin starts to burn. And I need to wear sunscreen ahead or wait until the evening. After the surgery of my legs to remove the calcium glaciers, I was hospitalized, and I even had to reconfigure my home to accommodate my new limitations. I was not even able to prepare a meal for my kids or take them to school or I was totally dependent on others. I had to take opiates for severe pain. IVIG treatments became weekly even up until now, and I started to receive Rituxan every 6 months since 2017, which helped after the shortage of an IVIG in 2019. Yet dysphagia, alopecia persisted, and fatigue challenged my daily life. I got physical therapy and occupational therapy for my legs and arms, along with water therapy. Exercising, walking, dry needling, and acupuncture was helpful. I currently see multiple doctors for my condition. I participate in research studies with National Institute of Health. As a nutritional health coach and community health worker, I learned that certain foods trigger flare-ups. Eating healthy became a part of my lifestyle. Managing dermatomyositis means not just treating the physical symptoms, but also understanding its mental and social impacts. I realized the importance of mental wellness in managing my condition. My biggest fear today is uncertainty about my future, financial hardships, not able to take care of my family, and not having full control of my next flare-ups and running out of options for medications. Thank you.
My name is Allie, and this is the story of my mother, Lulu. In February of 2022, my mother began with bilateral shoulder pain. She initially attributed this to her job. By March, her pain became excruciating, and she was no longer able to lift her arms. She also began with a rash, which was present on her chest and upper arms, and was very itchy. On her first visit to the ER, they diagnosed her with benign hypertension. Tylenol was prescribed and given in the ER, but nothing else was done. Her pain level never diminished, and nothing was helping her itchiness or her rash. In April, we drove to San Antonio to meet with a specialist who said, "It can't be DM. DM does not cause pain." He refused to do any studies for DM because of this. By late April, my mother continued with pain and an itchy rash. Benadryl was not helping. We took her to a second specialist, and I brought up dermatomyositis. The second specialist said, "This can't be DM. DM does not cause pain." He refused to do studies to rule out DM because of this. My mother was a single mother of 3 girls and had no family in America. My sisters and I took turns taking care of Mom. We'd place cold racks on her to try to alleviate her symptoms. As a registered nurse, I would inject toward her to try and help with the pain, but it didn't help much. Our continued ER visits were the same. They would tell us follow up with a specialist and continue giving her Tylenol. We took her to a third specialist, hoping that someone would listen. I brought up dermatomyositis, and the third specialist said, "It's not DM. DM does not cause pain." He refused to do any testing for DM because of this. By May, my mother wasn't able to swallow, and she was coughing frequently. We took her to the ER and was finally admitted. In the ER, a neurologist began treatment with IVIG and prednisone, suspecting myasthenia gravis. My mother could not walk, lift her head, or move her arms by this time. She was bedridden. My sisters and I spent countless nights rotating shifts to care for her. I told the neurologist I believed it was dermatomyositis, and he said, "I'll order a muscle biopsy." Because of this test, my mother was officially diagnosed with DM June of 2022. With the help of IVIG, prednisone, morphine, PT, speech therapy, and a PEG feeding tube, my mother was discharged from the hospital in June with treatment for DM. By July, She had entered remission and could walk, cook, and drive. In October, my mother woke up with abdominal pain. We took her to the ER and she was admitted. The doctor said my mother's gallbladder needed to be removed. She was septic. However, because of the pain, my mother's DM flared up. She was weak, unable to lift her arms again or walk. The doctors agreed to administer IVIG and prednisone and wait until my mother's DM stabilized before doing surgery. Unfortunately, her DM never stabilized. My mother had surgery in late October. She was intubated and transferred to the ICU after surgery. The pulmonologist extubated my mother on November 9th. At first, it seemed promising she would do fine, but she was too weak to continue breathing on her own. Her diaphragm was weak due to DM. The pulmonologist said they needed to re-intubate or she would die. My sisters and I stood at my mother's bedside, and we asked her if she wanted to be re-intubated. She shook her head no. We told her if she was not re-intubated, she would not be with us anymore. She shook her head yes. We asked if she understood. She shook her head yes. We hugged her and told her we would miss her. We respected her decision and placed her on comfort measures. My mother took her last breath on November 10th, 2022, surrounded by her daughters. She was 62 years old. My mother loved to cook and dance. She loved sitting outside on the patio drinking coffee, and she loved gardening. My mother suffered for months with pain, unable to swallow. She was unable to walk or move her arms. She had an itchy rash. It was physically, emotionally, and mentally challenging for her. An image I will never forget was seeing her cry from frustration and not being able to lift her arms to wash her hair. A simple task for many of us. My mother was a warrior and will forever remain a warrior.
Hello, my name is Veronica and I am 56 years old. I'm from Mexico City and I moved to Michigan in 2001. I was diagnosed with dermatomyositis on February 19 of 2021. Before this, I was a healthy and active woman. I had my first symptoms in January of 2021. Thankfully, my primary physician was aware of dermatomyositis symptoms and put me right away on 10 milligrams of prednisone. She referred me to a rheumatologist and a dermatologist. I was sad to see my face in the mirror. My big brown eyes that always had a sparkle were looking sad and inflamed. My face had rashes. My arms, my back, and my chest were itchy and irritated. Besides all these visible symptoms, I also had extreme fatigue and a feeling of stiffness in my legs and my arms. The doctors asked me to apply for short-term disability, but it didn't take too long for me to realize that I was not going back to my new job. A muscle biopsy, a skin biopsy, and various testing were necessary to confirm the diagnosis and to decide my treatment. My first treatment was 40 milligrams of prednisone in conjunction with methotrexate. This only helped with the inflammation on my skin, but not with my muscle weakness. I was put in Plaquenil for 6 months, but it didn't help. All of this was a new and overwhelming environment. After being healthy and going to doctors' offices 2 or 3 times a year, I ended up visiting doctors' offices and labs more than I ever did in my whole life, just in 2 or 3 months. In January of 2022, I started IVIG treatment. My first experience with IVIG, second effects, was very unpleasant. Fever, migraine, vertigo, and pain in my joints. I told my husband, if I must go through this every month, please just let me go. At the same time, I had in my head the question from my youngest daughter, Mom, you're not gonna die, right? My rheumatologist referred me to a doctor at the University of Michigan. The doctor from U of M requested changes in the way my IVIG was administered. She added a saline solution, pre-meds, and applied it at a slower rate. This was a game changer. On my second IVIG, I only dealt with the discomfort of the needle and extreme fatigue for 1 or 2 days. The doctor from UFN told me she was leaving Michigan. That was sad. And after that, I decided to join a support group. We went to see a new doctor in Chicago, and I got an invitation to join a clinical trial. After she explained the pros and cons of a clinical trial, my family and I decided to go for it. We really trusted her, and I knew she would take care of me in case I got the placebo, which I did. This was painful. My skin inflammation came back, but worse. I was put back in 40 milligrams of prednisone and into my IVIG treatment again. This was a step back. A new clinical trial opportunity came, and since my doctor was engaged in it, I decided to give it a try. At least in this clinical trial, I was able to take a few of my medications during the washout period. This was a big reason for me to join the clinical trial. Even so, due to the washout period, I had to miss the family vacation we had planned to Myrtle Beach. I asked my husband to go without me. I didn't want to create extreme changes to my family's life. They texted me and sent me pictures, and to see my husband having quality time with my girls was a motivation to keep my hope on this clinical trial. This time I got the medication and I started to see improvements. After 15 weeks in the clinical trial, I have high hopes that this will finally be my route to remission and a path that other dermatomyositis patients could follow to get better. I would love to see an easier way to treat dermatomyositis. Taking 3 tablets every day will be much better than having to deal with the second effects of prednisone and the discomfort of an IVIG treatment. Thank you very much.
Hi, my name is Romy. I was diagnosed with amyopathic dermatomyositis with severe skin issues and no muscle weakness. We are not born with a check engine light, nor do we have a crystal ball when it comes to our health and wellness. In 2018, I had heart ablation surgery because of AFib. Post-surgery, I was put on a blood thinner. 3 weeks after the surgery, I got my first introduction to dermatomyositis. I broke out in a rash and itch from head to my knees. We were out of town and my husband witnessed me scratching and ripping out my hair out of my head. My whole body itched. There were sores everywhere and my scalp and arms with no explanation. I immediately called my cardiologist, and I wanted to find out if this was a possible side effect of the blood thinner, but he told me that it was not. I immediately stopped and risked getting a blood clot. I felt hopeless and I could not sit still. I called my primary care physician and asked her to call the local pharmacy ASAP for a prednisone taper down. I also looked for a nearby cannabis store as I was contemplating jumping off the 19th floor balcony of the place we were staying at because I had to stop the burning. The itch, the fire, it just wouldn't go away. Once I got a dose down of prednisone, we went to a local cannabis store and I bought a green, smelly, sticky CB cannabis texture CBD oil, and I put it all over my body and my arms, and they actually started to ooze out black oozing tar out of my skin and calcium chips. We both looked in shock. I had to take a Xanax as I was not okay. I could not wait to get home to see my dermatologist. I was in such bad shape with rashes, sores, bald patches. I wore a hoodie to cover up and I went to the dermatologist. I was in a lot of pain and chronic fatigue and I was seriously on fire. My dermatologist took one look at me and said that I had to go to a specialist. I saw the specialist who told me it looks like lupus. He took a skin biopsy from my arm and I was diagnosed with amyopathic dermatomyositis. I was pretty certain that my skin would never be normal again. I immediately inquired about a clinical trial, but the doctor said there is no clinical trial and gave me the option of IVIG infusion or Cellcept. I took the Cellcept as I had a bad experience with IVIG on another autoimmune condition that I have. Later on, I was given the opportunity to take sub-Q, but I did not want to stay home and do my own infusions. So I wanted to, I didn't want to inject myself. I started to experience some slight improvement, and that I did not change the fact that I lost my hair and my skin was very pink. There was still pain and fatigue. I didn't know the treatment was improving my condition. I did not own research. I did my own research about the clinical trials for dermatomyositis, and I found one down the street at a competing hospital. And I contacted the specialist immediately. She took my case, and she literally had my best interest at heart. This clinical trial that I was put on required 3 infusions over 3 months. I had a horrible reaction from the clinical trial. I broke out for the 3 months that I was on the clinical trial. I had ice packs all over my body. My lymph nodes were swollen from my breast to my head. However, when the clinical trial was over, I started to see some slight improvement, actually a little bit of light at the end of the tunnel. I tried to get into another drug trial on an expanded access basis, hoping that it would work for my skin. However, the drug was withdrawn. I have to take 2 Benadryls a day to control the itch. I have to use tea tree oil, essential oils mixed with water. I wash my mouth out a few times a day to prevent from sores growing in my mouth and my tongue. I have to hydrate my body every day with heavy lotions and different kinds of lotions to keep my skin moisturized. I take cold showers every single day because my scalp still burns and itches off and on. And in addition to that, my nails are falling off, which is another horrible side effect. There have been times where my skull feels like it is cracking, and I have to literally hold my head together like this. And I sit in the bathroom and cry because I really want to scream at the top of my lungs. It depends on online. It literally, because of online support, has helped me cope because I know I'm not alone. Dermatomyositis is like medieval torture. I have to rely on oral cannabis to help keep my mind off the skin sensitivity almost every day. The Cellcept has helped me, but it's not a solution. It's very hard to concentrate and hide symptoms when my head's burning and itching. I might look like the vision of health, but inside, make no mistake, my inner dashboard is saying, put the fire out on my scalp, my ears, my body. Thank you very much for your time.
Hi, my name is Kambiz, and I'm 24 years old. 4 years ago, my vibrant 20s took an unexpected turn. Dermatomyositis, DM, entered my life. A relentless thief, stealing the joy and spontaneity. It's more than muscle weakness and a stubborn rash. It's a constant shadow that colors every interaction and experience. For a year, I battled an unseen enemy. Muscle weakness worsened, making everyday tasks like getting dressed or climbing stairs Herculean feats. My social life dwindled. Friends, initially supportive, struggled to understand the invisible shackles dermatomyositis placed on me. Dating became a minefield of awkward explanations and shattered connections. My romantic life was ruined. The loneliness was a constant ache. Finally, a biopsy confirmed the culprit, dermatomyositis, DM. Relief mingled with fear. Now I had a name for the monster, but the path forward remained shrouded in uncertainty. Methotrexate. The initial treatment offered some relief, but the relentless nausea turned every meal into a battle. A switch to a rheumatologist brought a new hope. Hydroxychloroquine and a higher dose of methotrexate injected. The hope, however, was short-lived. The nausea persisted, a constant companion that drained my energy and spirit. Determined to reclaim some semblance of normalcy, I sought a second opinion. Mycophenolate mofetil, MMF, replaced methotrexate, and the nausea finally subsided. Yet, the reprise came with a new challenge. Grueling intravenous immune globulins, IVIG infusions 3 times a month. Each session a 6-hour ordeal that stretched into 8 due to travel delays. The physical discomfort paled in comparison to the emotional toll. Stuck to an IV pole, the hours crawled by, stealing precious time I could have spent with friends or pursuing my passions. As a young man, the constant fatigue and migraines triggered by IVIG chipped away at my already dwindling social life. Steroids, a double-edged sword, offered temporary relief. They worked, but at a steep price. Weight gain deflated my confidence. The moon phase, a cruel side effect, mirrored the emotional one, a distorted reflection of the person I used to be. Dating became an impossibility. The fear of rejection overwhelming, frustration gnawed at me. The available treatments were a frustrating dance. Some offered benefit, but came with debilitating side effects. Others were simply ineffective. As a pharmacy student, I was aware of the emerging role of JAK inhibitors. With cautious optimism, I discussed Rinvoq upadacitinib with my doctor. While it offered some improvement, it wasn't enough. Back to the familiar, yet undesirable cycle of IVIG and MMF I went. Then a glimmer of hope emerged, a clinical trial for a potential oral dual TYK2 JAK1 inhibitor. The dream of a simple pill regimen that wouldn't disrupt my life fueled my decision to participate. Before I made this decision, I had to contemplate the risk versus benefits that come with a double-blinded clinical trial. Ultimately, the benefits outweighed the risk. It's still early and there have been hiccups, but the possibility of a future free from IV lines and debilitating side effects keeps me going. Of note, to this day, I do not know if I'm getting the real thing or placebo. Dermatomyositis may be rare, but thousands share a similar story. My hope for the future are that there will be increased research and development so that I can reclaim the joy stolen by this disease.
Good afternoon, everyone. My name is Jerome, and I'm here to share a glimpse into my life battling antisynthetase syndrome and its associated conditions. In August 2015, my world changed when I was diagnosed with dermatomyositis, myasthenia gravis, antisynthetase syndrome, interstitial lung disease, Raynaud's disease, inflammatory arthritis, and dyspnea. What began as extreme pain in my hands escalated to where I started having trouble breathing and with my vision. Walking became very challenging. As a Verizon fiber splicer, it became a near impossibility to climb ladders and even move from my truck to the customer's premise. I would take multiple breaks walking up a driveway. At one point, I fell into a window while talking to a customer. Speaking also became difficult. I could not have long conversations because I would become breathless. By the time I was diagnosed, I was spiraling. One of my worst moments came on a trip to Target with my wife. We walked up and my wife noticed that I was having trouble breathing and walking. She asked me to push the cart. I then told her I was going to go over to Starbucks and wait for her. Now, at this point, the breathing was terrible. I was fighting for every inch of air to fill my lungs. I desperately did not want to pass out in front of everyone. And as I reached that bench, I did not care how it looked. I laid down and I just asked the Lord for help. I really thought I was going to die. I struggled for any air I could get into my lungs. I begged, and then I promised God I would do everything. I would take every medication. I would go to every stupid doctor appointment if I could just get one little bit more air in my lungs. As everything started to get darker, I finally got just a tiny bit more air. While it was not much, it was enough. At the time, I did not know I was flaring. However, that is when my treatment commenced, with heavy doses of prednisone to protect my lungs. The steroids may have caused the avascular bone necrosis in both hips. Now, this treatment was followed by a combination of medications, including IVIG, rituximab, Celsep, gabapentin, etc., etc. Now, these medications helped reduce many of my symptoms. Also, I had to change my diet, and it helped relieve some of the problems I had with chewing and swallowing. Participating in the drug trial brought temporary relief, but post-trial, my symptoms returned with a vengeance. Shortness of breath, extreme fatigue, joint pain, shooting pain, double vision, muscle weakness, and muscle aches. Despite these challenges, recent treatments have allowed me to return to work. Although not at my previous capacity, however, the toll on my relationships, especially with my wife and kids, has been significant. They understand that Dad is not trying to avoid them. But on my bad days, I would excuse myself and go in my room and cry and pray and hope that things would get better. This journey has been arduous, filled with moments where breathing felt like a victory, and frequent trips to Johns Hopkins put life on hold. Managing a plethora of doctors, both appointments and treatments, mood swings, and long-distance drives for these treatments and appointments became routine. But amidst it all, my hope remains unwavering. I envision a future where a single tablet can alleviate my pain, swelling, and tiredness, allowing me to live a fuller life without me sacrificing those precious moments with my loved ones. I would like to thank you for listening to my story and for considering the needs of patients like me in drug development for autoimmune diseases.
My name is Emily Fillmore, and I have dermatomyositis. It's November. I'm sitting on a cliff overlooking the unending breadth of mighty Lake Superior. The crisp Minnesota air engulfs me. While my body shakes and buzzes, I wait for my breath and pulse to calm. The exertion intensifies my itch and nerve pain from head to toe. As I celebrate my accomplishment, aided by my husband and at least a dozen pauses on the easy half-mile track, I mourn the person dermatomyositis stole from me 28 years ago at 19. My heart opens to nature, swirling around me, and I cry conflicted tears. I am sad to be recovering alone, enjoying this breathtaking view of the crashing waters, and yet I'm happy my beautiful, supportive family can continue to the coveted point. I'm grateful I'm alive, but my ever-present state of impending doom persists. For every sweet moment of wonder, there are dozens of moments of exhaustion, fear, grief, and anger due to the constant intractable fatigue, weakness, and searing skin, nerve, and muscle pain. Even when I'm on medications that are supposedly helping. My DM is refractory or resistant to treatment. I've experienced multiple surgeries, Raynaud's, migraines, celiac, IBM, a torn labrum, autonomic dysfunction, mast cell dysfunction, miscarriages, fibromyalgia, anemia, falls, spontaneous bruising, and patakia, and more. It is unclear if my complexity arises from DM and long-term steroid use or is an anomaly of the sickness lottery. The totality of the above, lack of stamina, and the required vigilance to monitor symptoms have greatly diminished my quality of life. Looking at that vast lake is akin to gazing into DM's abyss. The symptoms cycle and repeat. The trial and error of medications is unrelenting. A medication helps for months or years and then abruptly stops. I feel like I am drowning. It is a full-time job to be sick, managing providers, insurance companies, appointments and tests, tracking medication titrations and delayed reactions, accepting that treatments start to work and then stop. I am evading the abyss as it strives to envelop me. I have used most common DM medications in differing combinations and doses: steroids, Cellcept, methotrexate, Imurin, cyclosporin, IVIG, sub-QIG, Plaquenil, Quinacrine, low-dose naltrexone, low-dose antibiotics, JAK inhibitors, and topicals. I seek relief with complementary modalities, I call it chasing rainbows, acupuncture, essential oils, herbs, vitamins and supplements, body work, and others. We maintain clean, minimal ingredient foods, toiletries, shampoos, and cleaning products at home to minimize my reactions. But DM never stops because there is nothing that satisfactorily addresses my disease without causing more issues. Some of my side effects include rashes, nausea, aseptic meningitis, suicidal ideation, severe diarrhea, recurrent shingles, we stopped counting at 40 times, uncontrolled weight fluctuations, increased cholesterol, blood pressure and heart rate, eye problems, osteopenia, cognitive changes, and roid rage. Since I am always experiencing a myriad of symptoms, deciding what is an emergency is another difficult job. We have to determine what is new and should be addressed, or what is just another day in Emily's body. It is draining and scary. Due to the suicidal ideations from JAK inhibitors and the shingles, I am excluded from most clinical trials. In November, my doctor told me about a case study of one similar DM patient using Safnello, a lupus drug. I had been to the ER for dehydration from sub-QIG that weekend. Desperate, I said, let's go. After another grueling process of insurance approval for off-label use, I had my first infusion in December. Within 1 week, the open oozing sores were closing. Within 1 month, the buzzing nerve pain had decreased and the redness was fading. My photos show the dramatic change from prior to Safnello to the face you see today. Without Safnello, I would still be rotting from the inside out, but I am still not okay. I am weak, I itch, I burn, I hurt, I wear out within minutes in normal everyday tasks, and I pay for activities for days after. Thankfully, I no longer feel like a half-alive, decaying pre-corpse waiting for the abyss to swallow me whole. Every little symptom startles me because I am petrified the meds will stop and the worst will return. But for the first time in 28 years, I have some relief and some hope. I hope future research protocols can positively impact the symptoms and experiences of DM patients. We deserve long-term relief and safety from the lurking dermatomyositis abyss. Thank you.